Get started. So, hello, everybody. Welcome to today's webinar. It's about how to recover when you've hit your boiling point with Bill Rawls, MD. I am Maria Rickard Hong. I'm the Education and Media Director for Documenting Hope, and I'm your host. If you have a question, just type it into the chat box, please, and we're going to be taking questions at the end. So, for those of you who don't know about us, Documenting Hope is a 501c3 nonprofit that provides root cause healing solutions for children's chronic health and developmental conditions. We provide resources and support for parents and practitioners who are ready to move beyond the conventional symptom suppressive approach to disease management and to instead use a root cause approach. And just a quick disclaimer about our webinar. This webinar is not a substitute for medical advice, treatment, diagnosis, or consultation with a medical professional. It is intended for general informational purposes only and should not be relied upon to make determinations related to treatment of a medical condition. Documenting Hope has not verified, does not guarantee the accuracy of the information provided in this webinar. And today, my guest is Bill Rawls, MD. He's the author of the Cellular Wellness Solution, this book, and he spoke in both the parent track and practitioner track of our 2024 Documenting Hope conference. For those of you that were there, hopefully you got to see him. So, hello, Dr. Rawls. Welcome. Thanks for joining us
Thank you.
today.
Yeah, pleasure. Always.
Yeah. So I think you have a really, really interesting backstory that people can relate to. So if you don't mind telling us all about it, I'd appreciate it.
I think all of us in the space that are looking at things differently all have a story. And mine was I, I've known medicine my whole life. I'm actually fourth generation doing this. And so I grew up in a medical family. My grandfather was a country doctor. I used to go on house calls with him. Um, Went to medical school and didn't like everything that I saw. It's on the chronic medicine rotations, patients just never got well treated with drugs, and they just seemed to be in this state of managed illness. And that pushed me toward choosing something that was more related to wellness and acute intervention, which was obstetrics and gynecology, bringing life into the world. And it was really very fulfilling.
Mhm.
But 40 years ago, that meant being in a small practice. I wanted to go to a small town, and I was taking call every second to third night. Um, 24-hour call, labor and delivery, emergency room, plus working in the office on those days. And and when I was in my 30s, I could do it. I could hang, I'd just work on 2 to 4 hours a night sleep. And a lot of times when I was off call, I was catching up on life and wasn't sleeping then. But in my late 40s, it started catching up with me. And finally, my health crashed. But it wasn't just, stop doing obstetrics, don't get sleep again, get back to normal. Even though I was forced to stop doing obstetrics and change my life, my body kept falling apart. And it really forced me to do a lot of soul searching. I went to my conventional doctors, lots and lots of testing. Some tests were slightly abnormal, but nothing that really defined a diagnosis. And a lot of people run into that.
Mhm.
Um, Finally had to settle for fibromyalgia, which is just, you get prescriptions for symptoms, and that's about it. And so I kept searching, thinking there's got to be something that's causing this. And I think a lot of people with chronic illness today, even when they get that diagnosis, it's like there's got to be something in there that's causing this thing, this driving this thing. And so I kept searching, found that I was carrying some of the microbes associated with Lyme disease, and thought, like so many people, this is the answer. I can get antibiotics and I'll be well. This will heal me. And that didn't happen. Several rounds of antibiotics made me sicker than when I started. And, I had a lot of symptoms. I had pretty significant heart symptoms and brain fog and all these things. It made it hard for me to work, but I couldn't stop working. So I started a practice just in primary care, just to make ends meet and work the best that I could all the while thinking I'm going to recover while I'm doing this. And tried a lot of things, became certified in holistic medicine, changed my diet, changed my lifestyle, worked really hard to recover my sleep, but still wasn't all the way. And finally found an herbal protocol for Lyme disease, started that and started getting my life back and realized how extraordinary, what a difference the herbs made. And I've spent the past 20 years really exploring that equation, understanding what was going on, how the microbes are actually making me sick, how these bacteria and other kinds of things that I had picked up, and what is this thing we call chronic Lyme disease. And I came to very different conclusions than most of the conventional community, but also most of the Lyme community.
Mm-hmm.
And for me, herbs were an absolute solution. I've created protocols since then that have helped a lot of people. And at this point, just out there helping people understand this thing that we're really missing that has such extraordinary value. Because I've now been taking herbals for 20 years, and I've experienced some of the best health in the past decade that I've had in my entire life. Still running at age 67. I'm running a full schedule and doing physical activities that I thought I would never do, hiking, kite surfing, all kinds of things. And it's this thing that I found. It's extraordinary.
Yeah, it's like you want to shout it from the rooftops about, like, why aren't you listening to this?
Oh yeah, for
Yeah.
sure.
Yeah, it's and that part of the problem that you alluded to is that mainstream medicine doesn't take chronic Lyme disease as a real diagnosis. They probably say it's more conversion disorder or all in your head, or just give you medications to, mask the symptoms without really getting to the root causes.
Yeah, well, they just don't really understand it. And
Hmm.
some of the things that I appreciate now, I was appreciating but not understanding way back when I was in medical school. And that is that our medical system is designed for and does an exceptionally good job at acute intervention
Hmm.
for problems that need immediate attention. And we do a great job with that. But all of our testing, all of our diagnostics, all of everything that works well is for isolated problems that are very, very well defined.
Hmm.
But no matter what chronic illness you consider, it's not one thing, it's everything apart in the body all at once. And instead of getting to the root causes, we're chasing all the dysfunction in the body and trying to stamp it out with drugs. And it's like trying to stamp out forest fires all over the place or repair, plugging holes in a leaky dam. You're
Hmm.
just without getting to the root of the problem, people aren't going to get well. And that's really led me away from to a very different concept of what chronic illness is. And chronic Lyme disease really opened the door for that.
Hmm. So you have a model that you show now about what you say are the root causes of chronic health conditions, and maybe you could explain that to people because I think
Yeah.
it's pretty enlightening.
I've worked for years trying to get things down to quick explanations that people understand. And so this little formula for wellness I have is it took me 20 years to get here, and it seems so simple and it's so obvious. And sometimes the obvious things are the things that we don't see. But it's basically like this. Your whole body is made of cells, right?
Mhm. Mhm.
We are cellular organisms. We started with one cell, and all of the cells that make up our body came from that one cell. So, unlike like a robot, we're hearing a lot about robots now, and we're comparing robots to humans, and it's really apples and oranges. So, a robot is a single unit, and if something breaks in that unit, we're going to find out about this a lot in the next coming 10 years. If something breaks, it's broken, it's done. You've got to fix it or replace the thing. Our body isn't a unit as much as a complexity of trillions of units. Our cells are like little microscopic machines. Like you could even think of them as nanorobots. So every one of our cells is an independent functioning unit. So our heart isn't as much of a unit as it is a collection of cells. And so we can lose cells, and our heart keeps on beating, and we don't have to shut it down. So we're constantly losing cells, replacing cells. And so those little functioning units, if you can think about them as little biological machines, every machine has operating requirements. So for our cells to function properly, they need five things. And this is true of every cell in the body because all the cells are structurally similar.
Hmm.
Cells need the right nutrients. Cells need carbohydrates, fats, amino acids, protein, etc., vitamins, minerals to function properly and do their job. They have to produce energy, and they have to have raw materials. Some cells need certain things, like our thyroid cells need iodine to make thyroid hormone. Our heart burns mainly fat for that kind of slow burn. So if you're eating a whole food diet, a diverse whole food diet, you're giving cells all that they need to function properly. So the right nutrients. Cells need a clean environment. So we're living in a very, very toxic environment, and we can talk more about that, but we're exposed to so many unnatural substances that humans never were. But these things came from natural substances, or petroleum and coal came from plant matter. So they're organic molecules that over millions of years got distorted to forms that just aren't compatible with biological life. And so when we breathe them in and get them in our food and all of these things, they become absorbed very easily, but then they get hung up in our cells and block functions. So
Hmm.
they make our cells less functional. They have to work harder. They burn out faster. So toxic environment is the second big stress that is affecting us. Third thing is mental stress, which affects sleep. I found out about this one the hard way.
Yeah.
Our cells need downtime. So our cells can rebuild themselves. And that's the big thing that separates us from machines. Our cells are constantly rebuilding. And that rebuilding process is the cornerstone of healing, which is really very important. So our cells, using a process called autophagy, are constantly rebuilding. They need downtime to do that. Now, some cells, like our heart cells, have to rest and rebuild in between beats. That's why our heart cells are so vulnerable. All the rest of our cells, though, they need downtime. They need 8 hours of sleep at night. So if you're getting an average of 6.5 hours, like most Americans, you're starting your day with a cellular deficit that your cells haven't recovered from the day before. And you do that day after day, like I did, and sooner or later your body's going to break down.
Hmm.
So adequate rest. The fourth thing is physical stress factors. Obviously, trauma can damage our cells, or too much cold, too much heat. But being sedentary does something that's even more harmful. It reduces blood flow.
Hmm.
So being physically active generates blood flow, stimulates our heart rate, dilates our blood vessels, and that flushes the space around our cells and cleans out debris and congestion and toxic substances. And if we don't get that, our cells, the spaces around our cells become congested and stagnant, and our cells basically can't breathe. So that's a really big one. And then the fifth factor is microbes. Microbes are our cell's greatest threat. And we think about infections, but the fact of the matter is things are constantly entering our body. Even right now, while you and I are talking, things are crossing over from our gut and our gums and our sinuses into our bloodstream and affecting our cells.
Hmm.
So our cells are basically food for microbes. That's the problem.
Yeah.
And so that's it right there. That is the causes of all illnesses. And we have different illnesses because we are exposed to different microbes, and we have different genetic factors about how we might tolerate one stress better than others.
Hmm.
So we get different illnesses because of those factors. But those are the root causes of everything. And
Right.
if you start getting to those root causes, it doesn't really matter what diagnosis you have. you're going to start solving that problem.